Good morning and welcome back. I hope everyone left yesterday feeling as inspired as I did. Once you've grabbed breakfast, please make your way back to the stage. If day one built the case for brain capital, day two is about activating it. It's a shift from insight to implementation, translating frameworks into business strategies, investment plans, and policy initiatives. We begin with a deep dive into the workplace. What can employers actually do? This session examines how organizations can address key risk factors such as sleep deprivation, stress, social isolation, and chronic disease, and how employers can build brain-healthy environments that support resilience and high performance. Before we jump in, a friendly reminder to continue engaging with each session, keys questions via live participation or the QR codes available on the screen or in the program. Now, please join me in welcoming our discussants to the stage. First, our moderator, Dr. Crystal Sexton, Global Health Analytics Manager with Shell Oil Company. Next, Dr. Sandra Bond-Chapman, Chief Director of the Center for Brain Health, D. Wiley Distinguished University Professor with the University of Texas at Dallas. Next, Kana Enomoto, Partner, McKinsey & Company, Director of Brain Health, McKinsey Health Institute. Dr. Ron Getzel, Senior Scientist, Johns Hopkins Bloomberg School of Public Health. And Brian Jebb, Global Co-Head of Compensation, Employment, and Governance with A&O Sherman.
All right, good morning. Thank you, everybody, for being here. We're going to spend the next hour-ish talking to you guys and then open it up for Q&A. We want to have this more of a conversation, so less of a presentation style. We won't have slides, but everybody will have a chance to jump in here with some conversation. So I'm going to give all the panelists a couple minutes just to introduce themselves with a brief bio so we can before we get started. Ron?
Sure, thank you. Good morning, everybody. My name is Ron Getzel. I'm a senior scientist at the Johns Hopkins Bloomberg School of Public Health, also the director of the Institute for Health and Productivity Studies, and also I manage 2 award programs for employers, one focused on overall health and well-being, the C. Everett Koop Award, and one focused specifically on mental health in the workplace, the Carolyn C. Mattingly Award.
I'm Kana Enomoto. I am Director of Brain Health for the McKinsey Health Institute. For those of you who don't know, McKinsey Health Institute is part of McKinsey & Company, but we're a non-revenue generating entity that is committed to adding life to years and years to life. So we're expanding not only lifespan, but also health span, and addressing workplace health is a big part of that. And before I came to McKinsey, I was the head of SAMHSA, which is the U.S. Agency for Mental Health and Substance Use.
Yes, it's great to be here. I want to thank everyone for organizing this incredible meeting with so many different entities. My name is Dr. Sandy Chapman. I'm a professor at the University of Texas at Dallas, and I started the Center for Brain Health 25 years ago, and it was so new, the idea of brain health, that we actually got a trademark on it because no one was even using the term. We set out to do the rigorous science to figure out, can we measure the complexity of your brain, and can we then optimize it, not just focus on injury and disease, but really wherever you start, whatever age you are, whether you're a peak performer or low performer, can you start to show gains in your brain, and then what are ways to enhance it? So we're looking for different corporations. We know that the brain is built longer in the workplace than any other time in our life, so thank you for organizing this with the workplace. It's important.
Thanks, everyone. I'm Brian Jebb. I'm an employment lawyer. I'm the head of our global employment group at A&O Sherman. We're one of the biggest law firms in the world. But relevant to this discussion, our firm has a global wellbeing advisory board. So I'll advise employers and clients on how to deal with these issues, but also I'm on our internal firm's wellbeing advisory board, where we talk about how can we get the most out of our employees and how can we support them in the legal industry, which tends to be kind of one of the more stressful industries around. So thank you for inviting me to the discussion.
Thank you, guys. And just a brief introduction to myself, I'm Crystal Sexton. I lead the health analytics team globally for Shell. I am a trained epidemiologist. I had a previous career in breast cancer research and academic medicine, so I've straddled the lines in both academia and industry. So kicking it off, Ron, I'm going to start with you today. We talk a lot about risk factors, right, and risk factors for brain health. So how are those, like hearing loss, obesity, hypertension, how are those associated with brain health?
All right, first let me point out that none of us have a script. We're here to be wild and woolly and to talk about stuff, some of which we know something about, some not, but we're here to interrupt one another and ask each other questions, which is great. So my background is kind of half of my career has been in the business world and the other half in academia. So I understand the issues, the problems of the business world and academia. So academia has a lot of precision. I was saying last night that they look for 0.05 levels of significance to make sure that it's right. The business world is more of a flip coin, a 0.50 level of significance, basically. You know, what does my gut tell me? And even though I'm a data nerd, my focus has been on corporate issues and companies and how do they keep their employees healthy. And when we first started, and in the audience is Eric Zimmerman, I started with him in the 1980s at Johnson & Johnson. When we first started, we had something called a health risk appraisal. And the health risk appraisal said, okay, what's your blood pressure? What's your cholesterol? What's your glucose level? Do you smoke? Do you exercise? Do you drink too much? All the standard traditional risk factors. And then, you know, other things like stress and sleep and depression, psychosocial risk factors, and they were all thrown into this gobbledygook machine that said, you're at high risk of dying any minute now, so watch out. And that was the approach. You know, basically do the things that I tell you to do or else you're going to die. It wasn't a very positive one. Here's what you could do to improve your health and well-being and stay fit and firm and cognitively conscious and aware of everything around you. And so we did a lot of work looking at the effects of these risk factors. In fact, a lot of our research, going back to the 1980s, working with Hero and Karen Mosley's here in the audience, looked at the dollar incremental cost of having a risk factor versus not having the risk factor. How much does it cost employers? And it turned out that about a quarter of extra cost for employers was associated with 10 modifiable risk factors, with the psychosocial domain being most pronounced. So depression and stress having huge impact on future healthcare costs. And that kind of, woke people up and said, oh, okay, so it's not smoking, it is absolutely obesity, but if you look at each individual person, it's psychosocial. So we began to think, well, that's the physical domain. What about the emotional, the social, the psychosocial domains? Brains are part of who we are. And if you don't get enough sleep, if you don't have good energy, enough good energy food, if you don't exercise, if you're stressed out, you're going to suffer, and your brain's going to suffer. We went a step further, by the way. I don't know if this is part of the conversation, but we said, the organization where you work may be sick. There's a lot of stress there, a lot of job demands. They're not giving you a lot of decision latitude. You're going in the morning, and you're coming out sicker at the end of the day because of all the stresses and all the things going on. So the organization itself needs to heal itself. And then we went even further, and we said public health. The community is sick. Doesn't have good infrastructure, doesn't have good schools, has crime, has poor housing, jobs are not there where they need to be. We've got a lot of things in the community that affect your mental health and well-being. So what does this all have to do with brain health? I think we look at this and say, well, the body is absolutely controlled by the brain. And we used to call it wellness, and then we went to health promotion, and then we went to health and well-being. Maybe the idea of brain health is something that'll catch on as a way of motivating the employer community to do more in prevention.
Thank you. And I want to highlight something you said there, Ron, because you talked about the organizational component, and that's something new in the work that we're doing, because we've started to measure 6 psychosocial risk factors across the organization. What is the impact of what the organization is doing, treating, and communicating to our employees on their overall health and well-being? And those results have been fairly startling. 3 of those factors are actually really high scoring and protective against outcomes like burnout, and 3 are incredibly low scoring and actually the lowest scoring of our entire work. And so there's a lot of focus on job demands, autonomy over what we're doing, how we handle change and communication to our employees. And we know that those things are making people sicker. So we're entering this new era in the workforce where it's less about you need to eat better, you need to exercise more, you, and a little bit on what are we doing to our employees that's impacting their health. Con, I'm going to look at you for a second because you just got back from Geneva, and I'm going to put you on the spot with regard to health and risk factors and whatnot, because I know you just returned from the World Health Assembly. So curious for your feedback on this topic and what you guys discussed there.
Well, one of the hottest topics, I think, at World Health Assembly is on the upcoming UN high-level meeting on non-communicable diseases, which we're anticipating in September. They just released the 0 draft of the paper, the concept paper for that meeting, and there was a lot of buzz among those of us in kind of the brain health, mental health conversation, because there's been advocacy. Because they originally put out the announcement for the meeting, and they just called it the high-level meeting on non-communicable diseases, and previously it had been non-communicable diseases and mental health. And I think the advocacy community rallied to say it's really important that when you talk about NCDs, you're combining that conversation with the mental health conversation, because we know non-communicable diseases account for 76% of deaths now. And so it makes a lot of sense for businesses to pay attention, for economists to pay attention, ministers of finance and health. And at the same time, what most people don't realize is that mental, neurological, and substance use disorders count for far more disability, years lived with disability, than cancer, heart disease, respiratory disease, and diabetes combined. So we think a lot about, we talk a lot about cancer, heart disease, diabetes, right? And not as many people are talking about brain health. And yet, for employers especially, right, this is actually a leading cause of disability. And so that's more relevant to you almost than the mortality data. And so we're excited to see that the UN did take a lot of the recommendations. We had a series with the World Economic Forum. There's, I think as announced, and this meeting is affiliated with our the series of dialogues that we're going to have around the world on brain health and the brain economy. And there's really a lot of interest from the private sector globally, because people are realizing that if we don't tackle brain health, we're not going to tackle some of our most important competitiveness, innovation, and economic viability questions.
Sandy, I see you eager to jump in there.
Yeah, this is such an area. I think what we want to share is that, first of all, it's important to realize that the whole concept of brain health actually exists, and that we shouldn't always switch immediately to brain impairment, mental health, Alzheimer's, the different things, addiction, the things that's going on. If we can really kind of reframe what is brain health, and we defined it 25 years ago as the continual promotion of optimal brain skills regardless of where you start. So it's capacity building versus trying to kind of overcome something. And the research we've done for the last few decades has shown that individuals can mitigate the natural cognitive decline that starts in our late 20s. As we look at neural systems, brain blood flow, connectivity, we see this decline start. It's not about disease and injury, it's just part of the process. Well, we've shown that that does not have to be the case. We can level that and people can regain capacity across these executive function, the way they think. And so getting workplace to buy in to realize that this is about brain health optimization. It's not about treating you and treating just a certain segment of the population, but this is for everyone, including the boss. Because if they don't buy into the culture of change and that if their brain doesn't matter, then they can ignore it. But surely, we're showing whether you're a CEO peak performer, you can get better, as well as the lowest performers. And people, whether they're 20, 40, or 70, can show gains. And that hasn't been done before. To show that there's actually skills that the workplace builds and stopping, Ron, some of the toxic and kind of some of the stressful things that are going on. If we stop those, then the people can thrive with their brain skills and get excited about what this amazing organ inside your head does. And for corporations to learn about that, because we still keep brain health more in what's a diagnosis and detection versus like we do for heart health. How much can my heart health improve? So yes, thank you. I was ready to jump in. I want us to really begin to change the conversation about what is brain health, that every single person will want their best brain year to be next year versus 10 years ago. Don't you? Well, we can make that happen.
So I'm going rogue off the questions because of something you said and we've talked about, but I'm curious from all of you guys, actually. Because the term brain health there's a visceral response at Shell by our leaders to that. So I'm really curious from your perspective, with all of your experience, is that a well-accepted term? How do you describe it across your organizations, the ones you work with, the ones you work at, et cetera?
Yeah, I'm happy to take that. I know, I work with a bunch of lawyers who, they always think they're the smartest person in the room. And when you mention words like brain health or wellness, particularly some of the older partners that I work with, they roll their eyes and say, oh, no one talked about that when I was a junior lawyer working all day. So I think the way you frame the question is important because you need to get leadership involved, as was said. So the way we frame it, we talk about sustaining high performance. And as soon as you brand it like that we have a stressful job, but to do your best, you need to be at your best. And as soon as you frame it like that, you get buy-in from leadership. Because I find, our junior lawyers and our junior employees are very comfortable talking about these issues, and it's part of what they grow up with. And so you don't need to sell it to them. And actually, we need to sell that we care about it to them. The harder thing, at least in my experience, is to deal with some of our older employees, but when we framed it as sustaining high performance, that the way you're going to get good work and the way you're going to get happy employees is to focus on these issues. That way we got people to focus on it.
Yeah, and I would say adding practical strategies so they know what it means. And part of the problem is 99% of all of our measures have been developed to detect what's wrong. And so when you say brain, all of a sudden they're, ooh, not today. I had too much to eat last night or too much to drink or, I'm not ready to do a brain thing. But when we focus it, would you want to see you against you and give them strategies? It's got to be actionable, not just this is where you are in a certain percentile, but it's you against you. And there's strategies that you can do to really strengthen the brain based on the science.
So I'm curious, Brian, when you move the subject and talk about brain and enhanced performance and productivity and so forth, I'm sure the follow-up question is, well, how do you do that? We've tried 100 different ways to get people to be more engaged, to perform higher. So how does brain health help me here?
Yeah, we put in a number of ways to measure it. And the first way that we do it, and I know it's been spoken about before, is to ask your employees, how do you feel on these things? How do you feel your mental health or whatever term you use is? And then you measure it over time. Is it going up or is it going down? Our law firm went through a merger recently. It was the biggest law firm merger in history. And I've advised on probably hundreds of mergers in my career, but I've never been in a merger. And it's much more stressful to be in a merger than it is to advise on one. So we spend a lot of time asking our employees, what would help them, and measure it. And I think what we've also found works is to not be too top-down about everything. Different groups deal with things differently. When I'm talking to my litigators, they have different approaches than if you're an M&A lawyer or if you're in the internal function. So I think it's not a one-size-fits-all. It's measuring, it's asking people, and then trying to get the results of what people tell us and try to action that.
Go ahead.
Yeah. So one of the big things that we've done over the last few decades, to your question, Ron, is to give people practical strategies. And so we've developed a training that we call SMART, and it teaches people brain-based strategies of how to think that we show can not only prime the brain to be productive, but it can also calibrate mental energy. If you think about, we don't think about how much brain energy do you have at any point in time. You need to calibrate that so that you do your heavy lifting mental task at certain times of the day. And then we show it reinforces strategic thinking, not rote thinking, because our brain goes backwards when we're into rote thinking, and then it ignites innovation. And as a cognitive neuroscientist, what I get excited about is that we have been able to show that people, if they intentionally and measurably, they can strengthen their brain systems. Using fMRI, we've shown that healthy people can strengthen their frontal lobe connectivity that goes along with better executive function. Think about being able to measure your brain change, along with changes in your innovative thinking, being able to prime your brain, solve problems, quick decision making, emotional intelligence that we talk about. We show connectedness to people, because our relationships with people is actually the most complex puzzle we do, and it's very important in our SMART training. We teach them how to do that. And then how do you embrace the change that's happening? Because our brain is really wired to deal with change, and yet a lot of people want to be, massive, stay the same. And so the brain can continuously improve if the culture wants to embrace change.
One of the things I found to your point, when we measured things, one of the things I expected was that our numbers would be worse because people are working too hard. That, lawyers work too hard, and I'm sure in McKinsey and professional services, it's like more. They joke that it's like it's a pie eating contest and the prize is more pie. But what we found is that our scores were lower when people were not challenged, when people didn't have enough work, when they didn't get a variety of work, they didn't get enough supervision. So it was one of those things when you need to, and I'm certainly not the scientist on this panel, but as I read it, if you're not using your brain, if you're not challenging your brain, if you're not developing it and you're just doing the same thing and you're not doing enough of it, we found our scores were lower, which was not the result, at least, that I was expecting.
So I'm curious, I'd like to ask Kana, who is formerly the head of SAMHSA, which is an agency focused on mental health and substance use and abuse. That's kind of a carve-out, whereas what we know about brain health is managing your biometrics, eating healthy, exercising, getting enough sleep, things that are not traditionally thought about as mental health issues. It's what your grandmother told you to do that you're not doing, that you should be doing. But how do you reconcile that with a compartmentalization of the way we deal with illness?
Yeah, it's a great question, and I was mulling that over because I think it is a both and. Right? We had partnered with Us Against Alzheimer's and the Business Collaborative around creating a unifying framework. So we did a we did an analysis of the literature around mental health and substance use, neurological health, and workplace performance. And across those, we looked at risk and protective factors, and there's significant overlap of risk and protective factors for all three of those things. And so we presented that as a sort of a simplified view for employers to say, all of these have to do with the brain, but your sleep, your nutrition, your social supports, your stress, they are common factors that employers can actually get triple, impact from. by addressing them. And then I also have this like part of my life and part of my work. It's very focused on the disorder side, right? Mental health, substance use, the services that support those. And it's actually prevention, treatment, and recovery. And I'm kind of at peace with that bifurcation because unfortunately, you said people have a visceral reaction when you say brain health. Do they have a visceral reaction when you say physical health? No, right? Cardiovascular health, we're all okay with that. We all think that's important, but we have these big question marks about brain health. Why, right? And so mental health and substance use from a public health point of view, from a policy point of view, they're still marginalized, right? We still don't see them as services that require the same urgency, skill, and compassion as we deliver for other areas of health. And so for that reason, I think it does need dedicated, targeted leadership, advocacy, and science, because otherwise it will get marginalized and we will fall further behind. But at the same time, I think there is a really wonderful movement towards bringing these things together and creating a more holistic view of how human beings are really wired.
So I think I mentioned the visceral reaction to brain health. What I find very contradictory to that in our experience, however, right? Because there's this, oh, no, we can't label this as brain health response. We spent years getting to the point where we are right now within Shell, and a number of those years was built on education of senior leaders. The scientific background that drives business outcomes, right? We were able to link health to things like employee engagement, safety, productivity, et cetera. But the thing they found most engaging was the neuroscience 101 that we talked about. How we treat each other, the impact that has on our brains, our decision making, the executive function, fast thinking brains versus slow thinking brains, and the need ultimately that we can't have a workforce filled with like petulant toddlers throwing temper tantrums. And when you put it in that perspective, they all said, well, that's really interesting, but we still can't use the term brain health. So everything we do is based on that concept. We just had to relabel it, and we still are talking about that. This has been almost a decade, and we're still having those same discussions around avoiding the brain health terminology, yet still working in that space. And also want to say, you guys mentioned a few things about change and how change is handled. Within our program, the organizational component that we're doing right now has generated a lot of interest. And one of those pieces is on change, and it is a very low-scoring construct. And actually, it differs by working type. Are you fully on-site, fully remote, or hybrid? And that has raised the eyebrows of us in health, as well as our executive leadership, on we are failing some of our workforce because the change that's coming, they are not absorbing that message very well and listening and preparing. And so it feels very much like a tidal wave and a slap in the face, when in reality, we've actually given lots of comms around it. It just hasn't reached the right population, so we're struggling with that.
So I'm wondering if the idea of neuroplasticity comes into play here, which is the ability of the brain to adapt. And I think we have become steadfast in our ways of doing things and calcified in many ways in our opinions, our view of things. There's very little room for middle ground, gray area. I'm a big proponent of bringing in debates into public schools so that you have concepts that you have to learn about, understand, and then at the last minute you're told which side you're supposed to debate so that you know kind of both sides, you know. And I think now we don't have enough of that where people can understand, visualize, and interpret other people's point of view. They come into and they say, this is the way it is. And I think that hurts business. And it hurts us as a society that we're not able to be empathetic and listen and work with other people.
You know, it's interesting about the idea of helping develop those brain skills in young people. And when the WEF jobs report came out in January, the top 10 brain skills, so they survey 1,000 CEOs from around the world. They ask them what are the most in-demand job skills in workforces today. And 7 of the top 10 job skills for 2025 are brain skills. Things like creativity, innovation, empathy, resilience, adaptability. And I thought, well, you know, okay, but in the future, everything's going to be automated. Everyone's going to go to AI. So in looking to the future, it's going to be all tech skills that people are emphasizing. But to my surprise, the fastest growing skills that these CEOs saw by 2030, half of them, so yes, AI, tech, those are at the top three, but then the rest really are brain skills still. And if you think about, like, as AI and automation take over and we have this technological revolution happening around us, what remains is what makes us human, right? And so those brain skills especially are going to be very important. And those are ones that are, developed in early childhood, and we worry about technology and the impact on those things developing as we have seen them in the past. And then also people not being as creative, not being as flexible because they are struggling with issues around mental health or substance use or neurological health. And so I think it is on both ends that we have to pay attention to these issues.
I'm amazed at staff people who basically say, just tell me what to do. Yeah. Tell me where to go, what do I do? And I said, well, think about it. Where could you go? What kind of creative thinking could you bring to this? And I think that's an issue, especially with young people, that they're looking to be directed instead of coming to ideas on their own. Go ahead, Sandy.
Yeah, one of the things that we say, they know if they come to work for us, we have a saying, there's no status quo here. So if you want a job and things are going to stay the same, you won't thrive here because things are constantly changing because neuroscience, and I really appreciate, Ron, you bringing up neuroplasticity. People are thirsty to understand what is it that I'm doing, and Crystal, you kind of brought it up. What is that doing to my brain? For example, multitasking. When people say, oh, I have to multitask, and I say, no, you really cannot, and it's very toxic. It's like cigarette smoking for the lungs is what multitasking is to the brain. We show that people's neurons are frayed. We see that pours cortisol on the hippocampus. You wonder why you have memory problems. It affects sleep, stress. So the workplaces are very interested in saying, what am I doing? I want to understand what can I change, and does this push to do more actually make the brain worse so that the productivity is a lot worse and lower quality? So I think that we're at a new age where people are really curious about what they should do, but status quo is really not good for the brain. But Krista, what you said is, how do you get people to embrace change? So one of the big strategies that we teach is we teach them to be future casters, to be part of the problem where they're constantly looking for ways to improve something, versus just let me do what I'm doing and I'm going to do it the same way. But every single thing you're doing, whether it's a relationship that's hard or an email that you're writing or a project that you're working on, can you keep trying to figure out future casting? The human brain is uniquely designed to do that. Employees get so excited when they're part of the change versus being, you've got to change. This is what's happening. That really is disruptive. But if their brain can be bought in, then they embrace change a lot more.
Mm-hmm. And I think it's, you're talking about employees that do the same thing. It's also the responsibility of management. If your employees feel like they're just doing the same thing, they're not learning, you know, certainly junior employees, it's not their fault. They're getting what their managers are doing. So part of the job of senior leadership in an organization is to make sure people are learning, people are challenged. And, you know, I'm an employment lawyer. I always think you get what you reward. Part of why managers should be evaluated on that. If employees don't feel that they're getting new skills, if they're not learning, if they're not challenging their brain and learning new things, it's really the job of their managers to make sure they have those opportunities.
So, Brian, following up on that, then, what are the interventions like you guys are doing? I mean, we've talked a lot about building skills and improving the workforce, but what are some of the concrete examples that we can give to people as takeaways from this session?
So for us, we measure, you know, we ask employees what they think and we measure that. We focus a lot on work allocation. When you're in professional services, a lot of work comes in, how are you going to allocate it? And there is a sweet spot. You don't want people to get too much work, and you don't want to get too future work. So if we focus on an equitable work allocation, we find that's a positive. When we're as part of evaluating partners, our leaders, part of what we do is to ask 360 feedback. What do their employees say about them as a leader? Are they challenging them? How is their mental health? That's one of the things we do. We also, at our firm, we've trained mental health allies. We've got, there's external organisations that can train people that, we're just lawyers, we're not the experts on it, but we go to the experts, and we have a bunch of folks, including myself, who are trained in it, so that way when someone's having a crisis or someone's stressed out or having anxiety, they can go to someone in the organisation that they know and they trust and who does what they do. It's not just an HR issue, it's part of the organisation.
So we teach a lot of strategies, and just to share a few. So one of them is, we know, is to filter out the noise, that we're exposed to more information, that, every single day we have more to-do lists. If you make down everything you have to do, more people that are contacting us. So how can you filter out the noise? And we use the saying that we borrowed from the late T. Boone Pickens: when you're tending your elephants, don't get distracted chasing rabbits. So we have people every single day choose 2 top priorities that you will carve out time, about 30 to 45 minutes. You will not allow yourself to be distracted. You will not do any multitasking. You won't have your screens. You will work on it. Individuals, when they tend to their elephants and don't get distracted chasing rabbits, they finish the task quicker, with deeper level thinking, more innovation, and they have more mental energy throughout the whole day. So it's figuring out, when do I have the most mental energy, and when should I do my elephants? So I want you to remember that when you're tending your elephants, because we are now distracted every 3 minutes, the longest someone can pay attention. Well, you can't do a task very well when you do that. So that's one of the task strategies that we teach, and people say that makes a really big difference. We actually have elephant and rabbit pads so that you can list your elephants. So we can make those available to you too.
I know people in our organisation who, they don't use as cool title as that, but they actually block time off their calendar every week to, okay, they only do a week, they're not enough. But it's, strategic thinking, or to your point, what are the 2 most important things? Because I think all of us, certainly as we get more senior, you put out fires all day. You're dealing with crises all day. And sometimes you don't have time to focus on the biggest priorities. And so one tip that I know people do is block an hour off their calendar, and this is where I have time to do that. I'm not going to take phone calls. And once it's in your calendar, then people don't bother you, people don't call you. That can be helpful.
Yeah, when people do that, they say, I have more mental energy at the end of the day to be with my family, and the connectedness is not just the people at work, but it's really having the mental energy to have good relationships when you get home. So really gauging how you use your mental energy with executive function, people didn't realize how important it was.
Yeah, I'm working with a federal agency where you can't bring your phone into the building.
Wow.
So the entire day, your phone is in your car, and you have to pay attention. You have to be there. You have to be present for everything that's going on. You can't distract yourself. And amazing, at the end of the day, how much you feel enlightened and how much you've seen and how much you've learned.
I like how when Sandy made her comment that multitasking is like cigarettes for the brain, a bunch of people put their phones down. We're all like, oh no, we're all multitaskers. And I would guess that many of us who eschew smoking, right, and would never use tobacco, but like are multitasking from morning to night. So it is a good awareness. I'm going to focus a little bit on, I would be remiss if I didn't kind of get to the mental health and substance use piece of things, because I think we have experts on workplace. But employers spend a lot of money on their health care, right? It's one of the biggest cost drivers for most companies. And if you aren't paying attention as an employer on what your benefits are, you are missing out. So what we know is that even in a commercially insured population, between 18 to 25% of your population has a mental or substance use disorder, a diagnosed one, like in their health care claims. And those folks are driving between 40 and 60% of your healthcare spending. And what we have seen, we worked with a couple of payers now, it's actually fantastic to see this. 5 years ago, worked with a CEO who was like a mental health evangelist, and his CFO was not such a believer. And she's like, oh, Dan's making us do all this, and it's really expensive. And it was integrating mental health, creating a continuum of care, integrating into primary care, and really focusing on getting mental health into specialty med-surg. And it did require an upfront investment, but a colleague of mine just saw the CFO last week, and she's like, I was really skeptical of that plan, but now we're saving $30 million a month on med-surg because of that, and you can tie it to the introduction of that integrated BH. So I think that's something that payers, employers, purchasers need to pay attention to, is like, what are the benefits that you're getting to your employees, and really digging deep to make sure that you're offering what is best-in-class care and integrated care.
And because I'm the lawyer on the panel, it's also managing your risk as an employer. The more issues like that you have, your legal risk and your potential legal liability can go up.
And one of the things I'd like to say too, because I agree with Connor, we need to recognize that. But one of the things that surprised us in the thousands of people now that we're following to see where they are, when they improve their executive function and their innovative thinking and deeper level and improve compassion and empathy, we find that it intercepts the mental health complaints with people that aren't full-blown clinically, but even people that are full-blown clinically with some type of diagnosis, depression, stress, and bipolar, they start to elevate their executive function. They start to say, oh, I didn't realize that if I just engage with people more, in terms of the holistic look at it, there's things that I can be part of the medical solutions too. So definitely they need to get the medical help, but it's probably both and, because sometimes the drugs alone don't help the people continue to thrive. So we're very interested in all the ways that we can to help people in the workplace, people in the military, people in the education system, healthcare, wherever they are, lawyers, to be able to find ways to thrive with capacity building, but then also to get the medical help that they need, because it's got to be both and, as you said earlier, Connor.
So the way we measure things is we actually have three pillars within health. One is on promotion of good health, right? And that's mental health, social health, physical health, and that's more your traditional health promotion components. We also have the protect space I mentioned earlier. It's about the psychosocial risk factors that within the organization itself, and we measure those and we intervene on those. But the third part is on access to care, timely care, equitable care. And one of the things that has surprised us the most in the past couple of years is the question around EAP services, Employee Assistance Program offerings. Over a quarter of our employees didn't even know that there was an EAP to be offered. And when we asked, well, do you know how to reach them? They were like, of course not, because I didn't even know they existed. So I started asking around to other countries, because in the US, on our homepage and our intranet, there's the banner on the right never moves, and it's always Employee Assistance Program, how to contact, what the theme of the month is, et cetera. And I said, are we an outlier? And every single country across Shell has an EAP banner on their homepage. So we are doing a disservice somehow, both to the EAP providers and to our employees, by not ensuring that people know that these services actually are there. And it's widespread, right? It's not just mental health. They cover a lot of things for our employees.
I mean, I do think that the EAP, the BH-focused or the mental health-focused EAPs are growing and are reaching more people, right? So they have, like, whereas you have like a normally 4% uptake, you have like a 7-11% uptake on the Lyras and the Springs and the Moderns, and I think they are delivering a good service. I do have the fundamental question, however, is like, how many of us go get our dialysis through the EAP program, right? Like, and then, even some of there's like complementary programs for mental health in schools. And people say, well, with the concierge fee paid by the school and then the reimbursement by insurance, we can make it a sustainable business model. And I was like, is the school paying a concierge fee for the broken arms and the sprained ankles? Like, why do we insist that, that people have to go elsewhere to get these services? So while yes, I think EAPs are a fantastic resource, and I'm glad that they are offered there, it does beg the fundamental question of, we've separated this area of health outside of mainstream healthcare, and then we've accepted kind of lower rates, that departments of psychiatry always lose money, et cetera, et cetera. Like, you know, the people who set the rules of the game are sitting in this room. Should we change the rules?
So you're proposing that EAP services, broadly defined, could be available like any other health service in the general community, and that would lead to better care, better health. The one exception might be worker to worker, worker to manager conflict, which you know, EAPs are designed to address, or you know, obvious substance use in the workplace. How do you deal with those issues?
Yeah, I mean, you know, SAMHSA has a workplace drug use program, or drug-free workplace program. It's important to do prevention, early detection, help people manage it. But then I think we should address them as health conditions, as any other health condition, right? Like, we have defibrillators in the workplace, but we don't like then continue to deliver your cardiovascular health, you know, services through the EAP program. And yes, I mean, toxic workplace, those interactions, and as we know, those are huge drivers of burnout, right? They account for, working in a toxic workplace accounts for 60% of the variance in whether or not people are going to have burnout. And so it is super important to address. I don't consider that's not a clinical issue. That is something that can be addressed by an EAP. But what I'm talking about when I'm saying these mental health focused EAPs, it's like, we have 12 sessions of therapy that we offer through this, or we have 25 sessions of therapy that we offer through this. I was like, how many sessions of PT do you offer? Right?
What about lack of access? There aren't psychologists, social workers, mental health workers out there in the community who could absorb that need.
Well, the EAP programs didn't mint them, right? They just stole them. I mean, I don't mean stole them, but they, you know, they're tapping into the same workforce, right? They didn't invent new psychologists or social workers, and some of them are using models. And this is the innovation that I think we should look for scaling, is that a lot of the EAPs use coaches, and so we're doing task sharing because it's not insurance. It doesn't require codes in the same way, so then they're not getting reimbursed by the insurance. So many of them are employing coaches, and I think there is strong evidence to show that lay people who are specially trained to deliver evidence-based mental health interventions can be just as effective and reach more people and reach people in different places than we couldn't get our trained professionals. And so that's been used a lot in low and middle income countries, where you have like one psychiatrist per 20 million people. But we can also use it in low resource settings, and or settings where people are harder to reach, where people are multicultural, and where people want to be met where they are. And so I think task sharing, I think the network adequacy or the lack of workforce is an issue, but it's not the only issue, and it is one that we can overcome.
Yeah, so I actually, one of my first jobs was working at a mental health center in West Harlem in New York City, and I was a mental health worker. I was getting my PhD at the time, but I was basically, most of the mental health workers were bachelor's degree at best, and they did an enormous job, a fantastic job at getting people resources, housing, food, other medical care that they needed. And I think use of community health workers to do many of the basic day-to-day meat and potato things is really important.
Yeah. But even CBT, right? I mean, there's transdiagnostic interventions that, I was trained to do CBT. I don't know that my taking lots of stats classes made me better at doing that. I think we know that lay people can be trained to deliver really specific interventions to address things like trauma, depression, anxiety, substance use, and it can be very effective if we're doing it, with fidelity and with good supervision.
So I want to just shift it just a little bit back to brain health promotion, just because, all the focus on mental health makes people so worried that something's wrong with them, and it is, and they need to get help. But what we see is brain health is a higher category of health. And when you give someone self-agency and executive function and better sleep, we see it spill down into improved mental health, and they also make better health choices. So individuals start exercising more, they start eating better, but it starts, and one of my sayings on my signature is, without brain health, you don't have health. So we really have to keep brain health promotion. It will help individuals that are dealing with mental health. I know from the military we work a lot with special ops, and they don't like the victimization of being labeled something and won't do it. And they say, this is the first time someone's helped me gain the skills to deal with my mental health, whether it's bipolar, to do something along with the medical care. So we definitely make sure they get the medication, the treatments that they need, but there has to be added some self-agency of what you can do. And the Brain Health Index that we've developed that gives you a composite score actually shows the relationship of how does your emotion, we call it emotional balance, because everyone in this room has some level of stress, anxiety, and depression. No one's free of that. So we call it emotional balance because one of the sessions we were to talk about today is resilience. What is resilience? It's not no stress and no depression or anxiety. It's knowing that you can use possibility thinking to see a way through. So the other thing that we do, and suicidality we know is caused a lot because people get stuck in their mindset and they don't see a way through with executive function. So we want people to know that connectedness to people and to purpose helps their emotional balance, their cognitive executive function and possibility thinking jump starts the way they deal with it. So I really want us to think about what the words that you started off with. Do you want peak performance? Do you want your brain to be better brain health? If we don't use, and brain fitness, they like better sometimes than brain health, but definitely peak performance. That peak, regardless of where you are, you can show a gain in your brain. It shocked us in the workplace that people can gain the highest of high, the middle, and the lowest of low. So our brain's neuroplasticity is so amazing if we would just embrace the potential of it.
So I think that's the perfect way to end this because I'm cognizant that we have our end set aside for Q&A. I do want to make one plea, and anybody who's ever heard me speak has heard me say this before, but you've heard a lot of good examples from the workforce. The workforce has tremendous influence over the health of its employees. I feel ethically and morally that the large companies doing this sort of work need to be less proprietary. Brian, close your ears because your legal colleagues really don't like me saying this. But I feel that if we're really truly in it for the greater good and making people's lives healthier, and to steal your mantra about adding life to years and years to life, we need to be in this together and stop being so proprietary. So let's find a way to collaborate, join forces, and actually start to make that difference. Thank you guys very much. We are over, and I apologize for that. Thank you.